Welcome back. Even if you have not personally experienced back pain, chances are someone you know and love has. More than 30 million Americans suffer from debilitating back pain, and now there's a groundbreaking treatment that's changing people's lives, the Intracept procedure. With more than 15 years of experience in medicine, Dr. Frank Ocasio is a board-certified anesthesiologist and interventional pain management specialist. He joins us now to tell us more about this life-changing treatment. Welcome, doctor.
Thank you, Jeannie, for having me. I'm excited to be here.
I'm so excited to be here. We were talking before we started to tape this segment all about back pain and different elements, but on camera, we're going to be talking about this amazing life-changing treatment. So, and we all know that back pain is really common, but tell us, is there a specific part of back pain treatment that's groundbreaking that we should all know about right now?
Yeah, so first of all, back pain is incredibly common in and of itself. There's over 30 million Americans that are suffering from back pain and really struggle to find relief. There's different types of pain and also different types of treatment options, which makes it a little confusing for patients. There's a specific type of pain called vertebrogenic pain.
All right,
Now,
wait. So for everybody that's watching, I know they're going to go to pick out their phones and go to Google or TikTok right now and check it out. So it's
right,
vertebrogenic
correct.
pain. Okay.
Yes,
Right.
vertebrogenic pain.
Yeah.
So vertebrogenic pain, only until recently, didn't have a clear diagnosis or way to treat. But now we have the Intracept procedure.
And so what is vertebrogenic pain?
So the best way to understand it is if you take your spine and imagine all the bones that make up your spine as blocks. So they're all stacked on top of each other. In between those blocks are little cushions called the discs. So over time, those discs start to break down, and inside the disc is material that can kind of work its way into the end plates, which is the bone on opposite sides of those discs. As they break down, they become inflamed, and there's a lot of nerve endings in there, and that pain gets transmitted through this little nerve called the basivertebral nerve. Goes up the spine to the brain, and then you sense pain. What patients feel, they'll feel pain with prolonged sitting like this, pain bending forward, pain twisting, maybe loading the dishwasher. And more often than not, they'll be struggling with this pain for decades, having gone through chiropractic therapies, physical therapy, injections, opioid treatments, and really not seeing relief until the Intracept procedure.
Wow, that's crazy and scary at the same time. But tell me about the Intracept procedure. How's it changing people's lives?
Sure. So one fun fact is that approximately 1 out of 6 patients with chronic back pain will actually be a candidate for the Intracept procedure because of this vertebrogenic pain. So it's a really groundbreaking procedure in that it's the only FDA-approved treatment for this specific type of pain. There have already been over 15,000 patients treated in the US, and it's safe, it's effective, minimally invasive, supported by multiple clinical studies. And the way that it's done is we use specialized tools to access and target this basivertebral nerve, which is giving sensation to these end plates. And through radio frequency energy, we're able to deactivate that nerve and provide long-term relief.
Oh, so there's probably no downtime or minimal downtime?
Yeah, the downtime for this procedure is probably a few weeks. And I'll be honest, I've had patients who have told me that their post-procedural discomfort is a joy compared to the pain that they've had for many years.
Wow. And is this something that older people are susceptible to, or younger people, or people of any age? Is it based on the work that you do, the life that you lead?
Yeah, it can run the gambit, to be honest. You could have a perfectly good spine, and then there's one disc that starts to break down and produce that end plate inflammation. And that could be a younger person who just herniated and damaged a disc. There could be someone who's much older, and over the years, over time, multiple levels get degenerated. And so it could be any age.
Wow, it's such great information. It's super exciting to hear that there's a solution for all of this. You're probably making so many people happy.
Yeah, no, it's a nice procedure to be able to offer to patients because to be able to take someone who's been dealing with years of pain and deactivate it so that they can live a healthy, meaningful life. It's nice to be able to offer that to people.
Well, this is fantastic, Doctor. Thank you so much for being on Liftoff. I really appreciate it.
Thank you for having me.
All right, everybody, don't go away unless you're going to stretch your back. We've got more great guests coming up soon.